Welcome to the second part of this plenary session. Firstly, let me just reiterate that I have here the presidents of ASFER and of UFA with me, who are witnesses of the launch of this Health 2020 policy, which Hans Kluge will be doing for us this morning, will be proposing for us this morning, a policy which has just been ratified in Malta by members of all of our Ministries of Health just 2 months ago in this very same place. So, without more ado, Hans, would you kindly launch for us the 2020 policy for Europe?
My name is Maria, and I've lost almost 29 kilos in the last 7 months, and I'm feeling fantastic, great, yeah. So I've been cycling around Copenhagen many times. It could be a half an hour up to an hour, but I try to cycle every day. I decided to do this because I was overweighted, and because I saw how it affected my body. It is just really bad for your health. And my grandma, she's really overweighted, and she can't do anything anymore. And of course she's old, but the main reason why she can't do anything is because she's big. Yeah, and I don't want to end up like that.
The 21st century brings many complex and multiple interacting problems, like rapid migration, urbanisation, an ageing population. And with this we have the socio-economic crisis as well. All of these things affect people's lifestyles and their health behaviours and affect health outcomes. On top of this, we have background issues like climate change, which are going to get worse as the century progresses. But also we're feeling the impacts right now with heat waves and fires and flooding, which all affect things like food security, the quality of drinking water, and we're seeing multiple impacts on health.
The WHO Regional Office for Europe plans to transform and renew the way how we think and understand public health as being the science and art of prolonging life, preventing disease and promoting health through the organised efforts of society.
The European Action Plan for Strengthening Public Health Services and Capacity are made up of 10 essential public health operations. And the core of these are made up of 3 elements of service delivery, and they include health protection, disease prevention and health promotion.
Health protection is to protect the health of the population against communicable diseases, against environmental hazards and public health emergencies. What we need for this is governments to have their plans updated, tested, but also have very clear lines of accountability. On disease prevention, in fact in the WHO European region we have quite a good immunization coverage. Another very important priority is to have, for example, strengthening of screening programs. A lot of this can be and should be done through universal coverage in the primary healthcare by delivering integrated care for the patient, and very important to empower the patients, the people and the communities. On the health promotion, it's crucial that we work together with the other sectors, which also really can help us create much better environments for people to live in, to play in, to grow and to age, and to enable the people to make the right choices for a healthy lifestyle.
We've seen the case of an individual like Maria. However, there are millions of people like Maria across the European region, and we need to do more to help create enabling environments for them to live in, but also to give them the right advice and information when they seek it. So health professionals, for example, in primary health care and in hospitals, all play a really crucial part in providing good information to enable healthy lives.
Public health is the health of the population. Everyone can play a positive role to improve the health and the well-being of the population. Our vision of public health is to create public health services which are really fit to tackle the challenges of the 21st century.
So to enable our vision to happen, we need to transform the way we work. We need to seek win-win-win solutions that have economic benefits, they have multiple social and health outcomes, as well as environmental benefits. This is really important so that we ensure that the environment we live in now is healthy, but also for future generations.
Good morning, everyone. It's a very great pleasure in the presence of the presidents of EUFA, ASFER, Julio, to represent our region director, Dr. Susanne Jacob, who is sending her best regards and also apologies that an emergency yesterday prevented her to be here, but gave the honor to me to launch, in fact, the new WHO European Health Policy Health 2020 and the WHO European Public Health Action Plan. What is the new WHO European Health Policy? When our regional director came on board, she was mandated by the 53 member states to come up in a very consultative way with the member states, the civil society, the partners, to develop a common policy framework for the WHO European region, which, as you might be aware, is containing 53 member states, to have some coherence across policies and programs in the countries to tackle the challenges of the 21st century. Challenges which have been mentioned already in the film and during the conference, but even complicated now by the economic crisis, which in fact is also threatening some very, very hard gains. It is not all negative news. The life expectancy has increased and is further increasing. Infant mortality and other indicators are improving, but still the public health, particularly the public health challenger, are putting a lot of strain on the health systems. The Health 2020 has 4 priority actions. The first one is to invest in health through what we call a life course approach and to empower people, number 1. Number 2, to tackle Europe's major health challenges of non-communicable diseases and communicable diseases. We all realize that the NCDs stand for the majority of the disease burden in the region, but we shouldn't forget that we still have old diseases like tuberculosis and now extensively drug-resistant tuberculosis, HIV, but also upcoming communicable diseases which deserves health protection. The third priority action of the Health 2020 is to strengthen people-centered health systems and public health capacities, on which I will elaborate. And the fourth one is to create supportive environments and resilient communities. In fact, a couple of weeks ago, in September, in the very same room here, in front of the 53 Ministries of Health, our WHO Regional Director launched the Health 2020 and one of its main implementation pillars, which is the WHO European Action Plan to strengthen public health. At the end of the session, the 53 Ministers of Health adopted the resolution, of which I am here putting forward the key elements. Number 1, the agreement by the ministers to take forward the European Action Plan at the country level. Second, to strengthen the 10 essential public health operations. Third, to assess public health services and capacity. Fourth, to enhance the collaboration between the countries. And fifth, leadership and innovation. In fact, we discussed this also at the session yesterday with NGOs, the role of the NGOs in taking out the action plan further. And in fact, my respected colleague and friend, Professor Helmut Brandt, was mentioning that a lot is known which is in the action plan, but a big difference is the momentum. In fact, Helmut was telling it is about teaching old tricks to new dogs. My other friend, in fact, Professor Wisowski from Poland, was telling, in fact, it's the other way around. It's about teaching new tricks to old dogs. But in fact, my own program manager, Joanne Nuis, was telling what we need, and we heard it also from our colleague from Gdansk, in fact, is innovation. It means we need to teach new tricks to new dogs. The most important is that public health is back at the agenda of the 53 Ministers of Health in the region. The last time an effort of WHO was undertaken was in 1998, and there was really a lot of debate, but ultimately the resolution did not pass. So we are extremely thrilled about this and extremely happy that, again, also symbolically here in Malta, we can launch this in front of the European public health community. This slide provides an overview of the resolution, the European Action Plan, and very important, the middle box, the evidence. So we followed a very thorough process to ensure that the European Action Plan to strengthen public health is underpinned by the best available evidence. And you see in the middle box only three, but the three major documents. It's based on a review of the public health services and capacity in 41 of the 53 countries in the region, and we worked very closely with the European Commission, in fact with the consortium led by Professor Helmut Brandt and the Maastricht University, also doing a public health capacity assessment in the EU countries. Second, we did a thorough review of the legal and policy tools and instruments. And third, together with the colleagues of the Observatory and the London School of Hygiene and Tropical Medicine, particularly Professor Martin McKee, we did a review of the institutional models for delivering public health services, acknowledging that, of course, this is very country specific. The overall vision of the Health 2020 and European Action Plan is to improve health and well-being for the people in Europe. What came out also from the evidence of the different studies is the inverse care law. Where there are greater health inequalities, there are generally less well-developed public health services and capacities. And we are extremely concerned what's happening with the economic and financial crisis, that we see in certain places a bit of erosion of what we call the social values of solidarity, equity and participation, and also in the donor community. And we as a WHO will continue to stand strong on the social values and also remind our counterparts in the governments that the solidarity and the inequities deserve a lot of attention against the background of health being a human right. This slide illustrates the interaction of the 10 essential public health operations, which in fact form the basis of the Public Health Action Plan. At the center, the middle box, we have the main areas of service delivery: health promotion, health protection and disease prevention. In particular, health promotion and disease prevention services need to be developed and strengthened in order to scale up our response against the background of an aging population and increasing levels of non-communicable diseases. But health protection, robust health protection services also will continue to be there, especially in order to deal with new challenges like climate change. Public health service planning needs to be informed by sound and comprehensive intelligence, and that's the first box at your left. The essential public health operations 1 and 2, surveillance and monitoring, but also which are informing health assessment plans. All these functions need to be enabled, and that's the third box at the right side, what we call the enabler essential public health operations: governance, public health workforce, financing, communication, and research. Another finding coming out of the service is the estimated expenditure on prevention and public health as a percentage of total health expenditure. In fact, the current average estimated spending on prevention by the health sector across the WHO European region is only 3%, which is astonishing, and for which in fact we have to commend all of you that you're working in a very effective and efficient way if you look at the scarcity of the resources. Yet an increase in spending is a very cost-effective way of improving health outcomes. One of our colleagues, I believe from EPHA, was mentioning about how to convince the policymakers. In fact, we had a milestone event in June in Tallinn with the OECD on the financial sustainability of the health systems, bringing together the senior budget officials of the Ministry of Health with the Ministry of Finance and the National Health Insurance Funds to put the evidence on the table. One of the first things we found out is that we really speak a totally different language. In fact, the Ministry of Finance seemed to have a vocabulary of about 25 expressions, basically all meaning no. If if you go to ask for help, the answer is no. The Minister of Health goes again, they say no again. And if you have the guts to go a third time, they say hell no. So during the 2 days of communication and receptions, I was going one by one. And in fact, one of the main lessons, besides of the language, is that of course the governments and the counterparts are generally concerned, because health expenditure in most of the countries is in fact the second largest expenditure of the government spending. But the quid pro quo, which they put very clearly forward, is to have your own house in order. Basically, that it's possible to get also in economic crisis more money for the health, as long as you can demonstrate more health for the money. So language is important, the evidence, having your own house in order, but also, as one of the colleagues mentioned, the politics of persuasion. And there, of course, we have the whole industry, which is very sophisticated, which is looking at economics of behavior and very, very advanced. And this is something, a nut that we have not cracked yet. So, coming to my last slide, how are we going and planning to take the action forward? The Health 2020 and the European Action Plan on Public Health is looking towards 2020. We are increasingly engaging with partners like yourself to identify strengths and resources across the region to implement the plan, because ultimately the strength of the plan will prove itself in the implementation at the country level, also subnational and local level. Next steps is to develop concrete plans and actions for implementing the essential public health operations. And like Walter was chairing yesterday our workshop with the NGOs to take that already a step forward, and Walter was telling, now we are making the action plan for the action plan. After the plenary, we will have the first meeting of the workforce development, the public health work.